What is anencephaly? Why does this happen? What should you do to prevent this anomaly? Let us discuss all about this in this video. Hi, this is Dr. Abinaya Vijayakumar, a doctor and a post-pregnancy expert. In this video, let us discuss A to Z of anencephaly. First and foremost, what is anencephaly? Anencephaly is a neural tube defect where brain fails to develop. Why does this happen? This happens because of various reasons, but the first prime reason being folic acid deficiency. Have you heard this name before? Yes, you guessed it right. Folic acid is the supplement that we advise the pregnant women to take in the first 12 weeks of pregnancy. Even before you conceive, if you are planning to have a baby, it is ideal to start with folic acid. Why? Because folic acid forms the foundation for neural tube formation. So brain develops from the outermost layer of the neural tube, which is called the neuroectoderm. I will try to add the pictures here so that you can relate to it. So usually it is like a sheath. Then later it forms like a dimple. So this dimple later inverts and forms a round-like structure, which is the neural tube. This round-like structure then develops into the brain. So when there is a folic acid deficiency, substantially, this inversion does not happen. Folic acid forms the foundation for nucleotide biosynthesis. This at the molecular level is very essential for the protein formation in the DNA. So only when enough protein is present, the DNA replication happens. That is, duplication and multiplication of cells happen, which is very essential during the formation of the neural tube. When this does not happen because of folic acid deficiency, there are not enough cells for the formation of the neural tube and so the formation of brain. So this results in absence of brain formation, which is called anencephaly. This is a fatal condition where the baby is not going to survive for more days. What other conditions can be responsible for anencephaly? Hypertension and diabetes mellitus increases the risk of anencephaly, but not the sole reason for anencephaly. And there is a minor genetic predisposition. But the prime most reason remains the folic acid deficiency. So how can you diagnose anencephaly? Anencephaly is usually diagnosed by the NT scan, that is a neural translucency scan, which is done around 11 to 13 weeks of pregnancy. Here we measure the neural tube thickness, if at all, if it is increased than the normal range being 6 mm, but usually we will see it around 2 or 3 mm only. If it is more than 6 mm, that means there is a problem with the neural tube formation. There is some defect present. Also, high levels of alpha fetoprotein, which is done during the prenatal screening test, also indicates some problem with the neural tube formation. Your gynecologist will advise you to go for medical termination of pregnancy because this is a fatal condition and the chances of survival of the baby, even if the baby is born, is very low, and the quality of life being very poor. So what should you do to prevent anencephaly? Folic acid intake during the initial weeks of pregnancy plays a vital role in reduction or avoiding neural tube defects like anencephaly. So if you're planning for your pregnancy, ideally visit your gynecologist much earlier to start your folic acid even before you conceive. This way you reduce the chances of neural tube defects like anencephaly. What is the dosage of folic acid? It is 400 micrograms per day. So the medication which is usually prescribed, the dosage is around 500 micrograms. If you found this video informative, do give me a like and also share this video with another pregnant woman so that she's aware about the importance of folic acid intake during her pregnancy. Having said this, pregnancy is not just about the physical growth or defect that is present in the baby, but about the mental development of the baby. Garbhsanskar is an ancient old technique where the pregnant women are guided in such a way that they have a conscious and mindful pregnancy so that these 9 months form a healthy foundation for a mentally sound baby. As well as we should remember that the fate of the nation is decided in the mother's womb today. So if you are not mindful about your emotions and how you tackle your pregnancy, whatever you do during the later stages of the child's life, it's not going to yield you benefits. So start learning simplified Garbhsanskar techniques with 500 plus happy mothers in our Get Mommified Hub. If you would like to know more details about the course, do check out the tag mango link provided in the description and also message me on Instagram. My Instagram ID is mommy with bigger dreams. Do take a minute to subscribe to my channel and press on that notification bell icon to receive regular updates on upcoming videos in my channel. Until I meet you in the next video, stay happy, stay mommified.